Hello, friends. Let's talk about diabetes today. A concise overview of the pathophysiology first. Diabetes mellitus encompasses a spectrum of metabolic disorders caused by chronic hyperglycemia or high glucose levels resulting from defects in insulin secretion, insulin action, or both. This can lead to disorder in carbohydrate, protein, and lipid metabolism, leading to end organ or multi organ dysfunction. As you know, there are different types of diabetes. There is type 1 diabetes, which is an autoimmune destruction of pancreatic beta cells, resulting in absolute insulin deficiency. There are specific HLA genotypes that are associated with increased susceptibility. Type 2 diabetes is a heterogeneous condition marked by varying degrees of insulin resistance, impaired insulin secretion, and increased hepatic glucose production. Progressive beta cell dysfunction typically follows a period of compensatory initial high insulin production. Then we have monogenic diabetes, including MODY, which has a very distinct therapeutic and inheritance pattern. We also have secondary causes for diabetes, usually seen in people and patients with pancreatic disease, like chronic pancreatitis, cystic fibrosis. These can be drug-induced. Let's talk a little bit about diabetic complications. We can usually classify them into microvascular and macrovascular diabetic end organ complications. Microvascular includes diabetic nephropathy, diabetic retinopathy, and diabetic peripheral neuropathy. Macrovascular complications include ASCVD, which is increased risks of MI, stroke, and peripheral arterial disease. Cardiovascular disease remains the primary cause of mortality in diabetic patients. Talking about treatment, we have contemporary approaches which focus on glycemic control and targets HbA1c based on comorbidities, life expectancy, and hypoglycemia risk. For type 1 diabetics, we have advanced insulin delivery systems, which include closed loop systems, smart pens, etc. For type 2 diabetics, the first line therapy still remains metformin. We do have plethora of other anti-diabetic medications like GLP-1 agonists, SGLT2 inhibitors, and many more. Emerging approaches include dual GIP-GLP-1 receptor agonists showing promising efficacy, immunomodulation in early type 1 diabetes. Let's educate ourselves and have further discussion. Thank you for your attention. See you soon.